Climate change is not only about the melting of iceberg, snowstorm, and drought. Even if Hong Kong is situated in a subtropical climate, it will still face the health impact accompanying climate change. Who is most vulnerable to such health impact? Patients suffering from severe illnesses, children, elderly, people with chronic diseases, and those with low socioeconomic status confronted with a higher health risk that climate change brought about. Extreme temperature events pose health impacts with varying degree of severity. People may be sick and hospital admission is needed for those having more severe symptoms. Death is also a probable consequence. Mild discomfort and symptoms due to climate change should not be dismissed. The Chinese University of Hong Kong studied the cases of requesting assistance in the community. Elderly usually feel sick under hot season. The requests for assistance go up on days with high temperature. The Chinese University of Hong Kong utilized the data from Hong Kong Observatory, Senior Citizen Home Safety Association, Environmental Protection Department, and the Center for Health Protection and established that when the highest temperature exceeds 32 degrees Celsius, the number of emergency help calls increased significantly along with temperature rise.
Hello, sir. Are you feeling unwell?
Yes, I am dizzy and I feel like I can't breathe.
During periods of hot season, almost half of the calls reported symptoms of dizziness, shortness of breath, and general pain.
There's also a gender difference on responses to high temperature events. When the temperature climbed up to 30.5 degrees Celsius, call frequency among female increased. As for call frequency among male, it started to increase at 33.5 degrees Celsius. This data would help the respective government authorities to apprehend the help-seeking patterns during hot seasons. This would also contribute to establishing a more comprehensive hot weather warning system. January 24, 2016 was the coldest day ever in Hong Kong since 1957. To investigate the impact of cold spell on Hong Kong community, the Chinese University of Hong Kong conducted a territory-wide large-scale telephone survey. Amongst the 1,017 participants, 67% reported that cold spell brought to physical discomfort. 13% had to seek medical help. For those who needed to seek medical assistance, around half of them would go to private medical clinic, and that followed by public clinics and traditional Chinese medical practitioner. Around 13% of the interviewed participants would buy over-the-counter drugs. We also studied the health impact of the 2016 cold spell, with the scope encompassed musculoskeletal pain, respiratory and cardiovascular symptoms. Musculoskeletal pain was amongst the most commonly reported.
These studies reflected the link between extreme weather and health impact of various subgroups in the community. Government and other community organizations should always consider the specific needs of high-risk groups. This helps enhance the existing warning and response mechanism.